Hey, CAM followers. I am very, very excited to introduce you to Tulia, who is going to be talking to us about something that's going to take you out of your comfort zone tonight, guys. We're going to go into the world of fascia, and it's mind-blowing. By the end of this evening, I think a lot of you are going to go, whoa, what just happened? Because we've stepped out of talking about arthritis management very much on a pharmaceutical, in a nutritional, in a surgical sense. This definitely is in the world of physio, but we're going to go into a lot more detail. Now, let me just introduce you to Tulia. She's in the middle part of Finland because I can't say it. Would you like to say it?
Yeah, I can say it. I'm from Lempäälä, so near Tampere, if somebody is familiar with the area. But hi, guys, and it's very nice to be here with you all.
So can you tell people about yourself so people have trust and faith that you
Yeah, I have been a physio 20 years, so I have been treating humans and animals already quite a while. So different kind of cases have been going through my hands already many years. But the last 10 years, I have been really focusing myself in the fascia, and I have been really digging really deep with this thing, and I'm always very fascinated when we come to this topic, and I'm very happy to teach it and talk about it and share my knowledge about it.
Their presentation you're going to see, guys, is nuts. So I have made lovely friends with a lady called Helly, who's been on twice, who blew my socks off with her talk about obesity, biomechanics obesity. And then I emailed her and said, look, I really need to talk about fascia on CAM. Would you like to do it? She went, no, but I know who will.
Yeah, greetings to Helly.
Helly surely is listening. And so she very much gave you the mantle to carry for this one. And the presentation is awesome. So let me just quickly tell you why this is important. So I've been a vet for 20 years, and around about 2013, I got a little bit obsessed about arthritis and about musculoskeletal management from a first opinion practitioner point of view. And the simple thought in my head was, oh my God, this is a big volume of this dog in front of me. It's like 45% of this dog's body weight is muscle and soft tissue. And I don't know very much about it. So I went on a little journey, and I went and did a clinical massage course called Garden Myotherapy, where I got introduced to fascia, which I had learned a little bit about at university, but not to any extent to really understand it. And I was very much one of those classic students that in the dissection room, they'd be like, right, pull that white stuff out the way and find the muscle. Pull the white stuff out the way, get down to the bone and the nerves and the blood vessels, see where they go, see what they do. And this white stuff was everywhere, and it was a real pain to pull off, getting your scalpel blade in, trying to peel it off. And it really wasn't given the huge amount of respect that it's now accruing. And it is a very big topic in human medicine, and it's a very big topic in animal medicine. So I think what the best thing to do now is hand over to you, let you do your presentation. I'll try not bite in, I promise. Then people can start seeing how this all fits together. And at the end, we can take questions and try and piece it all together. Go for it, Tulia.
Yeah, thanks. And really, I will share you my screen. So I'm very visual person, so that's why I'm doing it this very visual way. And I think the topic says it all, because forgotten fascia, like you really said, that take the white stuff away, you don't need it, put it on the trash or something like that. We need this white stuff. We really need it. And after a while, you understand why. Why fascia really matters. We need it. It's part of the stability system, part of the support system in our body, in our dog's body, and also, well, in everybody, every living body. And we are talking something about the relaxation and balance also. And then we are thinking the force transmission and proprioception. So this is a short time to give you really idea about what is happening in the body, but I hope I can really guide you in the way that why fascia matters. And it's not really only the white stuff, it's meaningful white stuff. We need it. And for example, if we think stability, support, we have to think how our dogs are moving at our house, outside. Are they sleeping floors or something like that, which are taking the stability more problematic. So always keep in mind that how my dog is using stability, how it supports its body. And when it's relaxed, is it balanced when I do my things? Agility, for example, is there balance in there? And of course, always when the dog is moving, force is transmitted, because when we are moving, we need proprioception. And the dog is using the proprioception when the paw is landing and the body is moving forward, when we are doing the turnings, or when the dog is hearing you somewhere and coming quickly to you. It's using the force transmission, it's using the proprioception of the body.
Just explain proprioception, because some people won't know what that is.
Yeah, so proprioception is the sense that that the animal or you know where your body parts are. When you put your hand, for example, to your head, you know that, okay, here is my hand, here is my head. So you sense, it's the sense of feeling where you are and how you feel. So the similar.
It's how I know that my hand is above my head. All of the information of body posture, changing muscles, changing joint angles. Yeah. My brain takes all of that information, loads and loads of information, and in a split, goes your hands above your head.
And the receptors which are taking that message from your extremities or from the dog's legs, the receptors are embedded with the fascia. So our nervous system is wrapped with that white stuff which is everywhere. So there are signaling system in the body which is sensing things from outside of the world and also the inside of the body. You can feel your heartbeat, and you can think that you can feel your breathing, for example. So those are the inner world of the body. And of course, if somebody is pushing you, your system and the receptors will react, and your brain will be thinking, okay, don't push me, I'm here. Or if you are not really awake at that moment, you might be falling. But everything is connected to the receptors.
And I think we have to be like, the pushing example is such a good one, because you know how much you've been pushed. Your brain has calculated at what angle you are, at what risk you are falling, and exactly how to counterbalance, recorrect yourself, get yourself back to a stable zone in milliseconds.
Yes.
And it's helped with fascia, you know.
Yes.
So when I talk about more rugs, less drugs, when I talk about don't allow them to slip and fall, be careful of stairs, this really, really is important. But by the end of this lecture, you're going to really be screaming more rugs, less drugs. So stick with us.
Yes, and that's like the stability, that's like the balance, and that's like the correct force transmission. If there is like unexpected happenings, the body has always more troubles to compensate that one. So when you anticipate, when you know what is happening, it's easier for the body and for the nervous system to work. Yeah. This one is giving you an idea that the fascia, it's everywhere. It's not only the tendons, it's not only the ligaments, it's every muscle is wrapped with fascia. Every organ, for example, heart, lungs, intestines, everything. And also under the skin, we have already fascial layer. I will show you one picture about that one, and you will understand maybe from that one easier that it's really everywhere.
And I think, again, I'll just butt in, because this is always good. For the meat eaters out there, you know, when you've got a pork chop, eye of the muscle, and you're pulling it away from that piece of bone on your plate, and there's all of that white kind of cobwebby. Some of it's thick, some of it's very thin, some of it is literally cobweb thin, and you put it away and you can almost hear it. That is fascia. Fascia's everywhere. And I forgot to mention, guys, within this talk, there is some gruesome photos, but Tulia is going to say when they come up. So there's a couple of action shots. If you do have a queasy disposition, we will warn you, but it is so worth looking at because it will blow your mind.
I would say so. Okay, here is our Rocky mini pin, and he is the model of the day because he's showing you how the bones are in your dog. So the bones are like this, but not only the bones, and if you take only the joints, they are not holding them under the skin without any muscles and without any fascia. So myofascial system would be the good naming for that one. So everything is coming together. We have bones that are giving attachment point to muscles and connective tissue. And of course, joints are allowing movements. And then when we have a muscle working, it's creating tension and activation. And then this activation is transferred via connective tissue. So that is also very important thing to understand, that muscle itself, it's more or less bulking. And when that bulking comes, then the tension is transferred in the fascial layers, and that will get the activation in more and more, like from the hind leg pushing, like the hamstrings working and going to the back muscles and then there to the neck muscles. And that's why we need that white stuff, that it is helping the activation come from the hind leg to the back and the abdominals and then to the front, for example.
Yeah, because it kind of connects, it makes everything work in unison. Habit, we'd all be walking very weird.
Yeah, I think this image will show you nicely that one, because this, if we don't have the connective tissue attached, we would have individual muscles and they would be flaring out in the wind like this, because we need something to glue them into the right places. And the fascia is doing that part. So muscles and tendons, they are forming units, and that's again coming to continuums. So not really there in the body, there is no individual structures anywhere, because all the internal organs are also connected to the same place with the fascia and connected to the muscles.
So when I was back at uni, let's go back 20 odd years, stuck in a dissection room as a first year vet, we very much looked at muscles individually. Oh, this is biceps femoris, and this originates here and it ends here and it does this. This is the sartorius. This originates, inserts there, and it does this. And you were taught very much that they all had their separate role. So you started thinking that moving the leg forward involves this muscle and this muscle, and that's job's done. But it really isn't like that. They all on top of each other, influencing each other, because there's this big spider's web
around
connecting it all together.
Yeah, and in studies, in many studies actually, it is found that 30% of the force transmission, it's going to the fascia itself. So when you activate the muscle, 70% of that activation is really coming from that muscle tissue, but 30% is coming from the white stuff. So it's quite a lot. If you think you have tension somewhere, you have, for example, your dog are having, for example, cruciate operation, and you have a scar, and there is scarring along the lines, and then the fascia doesn't work like it was working before. You lose the power. You lose 30% of that area's force transmission. And I think that's a lot.
Yeah, I just remember when I was doing this course and learning more about fascia, my surgery changed dramatically, because I was like, oh my God, fascial lines. Whereas previously as a vet surgeon, it was preserving the muscle, it was preserving the nerves, avoiding vessels, and there was less respect for the fascia. But then I started realizing that we have fascial lines for our bodies that are tension and strength lines and mobility lines, and disturbing that can really destroy the interplay between different muscle groups and regions and fluid movement.
Yes, and that's so important. That's like the exclamation marks, like 50 exclamation marks on that, because you really need to understand how the fascial lines are going and understand what muscles are connected together in the same movement patterns, because that's really helping to understand how the whole body works and how the muscles and bones are connected to the functional units, and then how the joint capsules, how all the ligaments or the retinaculus around the joints, how they are connected again to the muscles and to the lines. So these are like the nomenclature here. So we have deep fascia, profound fascia, we have superficial fascia, fascia of the internal organs. So you can really find things when you are putting this on. And we are preparing a book about the animal fascial atlas. I really do hope that it's out next year, but there, if you get really excited, you could get
Is that you and Rebecca
ideas.
doing that?
Yes.
I've got to say high five to Rebecca. So I was on one of her courses last year.
Yes.
And it was 2 days. She talked non-stop about fascial lines and how you can look at a dog's posture and you can assess fascial lines that are disturbed, and you can trace to the original pathology.
Yes.
So you can be able to say that dog, that posture, that fascial restriction would suggest something along this line is influenced, maybe hip arthritis, arthritis or elbow arthritis. It was fascinating. So the book is amazing.
And more you really understand how the fascia is under the skin, you can learn to see connection and learn to see the anchorage points and where they are, like where the tension is most often gathering. The next image I will be showing is dissection image. So keep your hats. Okay, so like this. So on the left side, we have a hind leg, and here you have like the patella would be here. So the biceps femoris muscle is coming here, and this would be rectus femoris muscle here. And the glutes will be down here. So now you can see quite often people are... see, you can really see the white stuff here, because quite often people are thinking that when you take the skin off, they are looking like anatomy books. So you have the muscles like do, and then it's like this, but it's not. It's like this. You can really see that the white stuff is everywhere. This one is like the stomach side. Here you have the back side, and this is the zoom image from there. So you can see how the collagen is lining. And now quite often you can see that there is layers. There's 3 layers more or less. Many places you might dissect even more. Maybe this is giving you more idea with that one. So there's layers on top of layers, and between these dense connective layers you have loose connective tissue. I will show you one video about that one also. But I think how cool is this? We have like a sock on top of the muscle. And maybe everybody who has been small, and your mommy has been saying that put those trousers on and they are a little bit twisted or something like that, and then you are crapping all the time your trousers up. So that is good idea if you have a torsion or rotation somewhere, for example after sleeping, after injury, after operation. The dog might feel that there is some kind of rotational pulling somewhere, and it cannot correct it by itself.
Yeah, and I think that's a really good point. So let's keep bringing it back to things like arthritis. We've got many followers whose dogs will have had surgery. And so there is going to be damage, and damage is going to make this fascial tissue, which is all around that joint, all around that bone, is going to contract down. It's going to kind of scar, isn't it? And it's not
Yes.
that same freedom of movement.
Yeah, and about scarring, I would I would talk all day, and I have also images about that one, but it's not here on this presentation. But we could also do this kind of thing, that what we could do when you have a scar. It's not rocket science. You could easily teach people how to modify the scar, how to get the elasticity back to the area.
Yeah, and we will come to that at the end, guys. So don't think this is just about this is the problem and we're not going to tell you anything further to try and help fix it.
Yeah.
Section at the end. But
yeah,
and just say the words that kind of blew my brains when I was learning about fascia. So for the people that have had some kind of like biology, A level, or they've done something medical at uni or college, we've got our circulation system, which carries blood. And so it's a communication pathway delivering blood with oxygen and hormones around the body. We also have a nervous system that is electrical transmission, sending information around the body, making sure we work as one. Your fascial system is a form of another communication pathway, making sure that the body works together. So one of it is disseminating information, keeping things together, making sure there's fluid movement, giving structure support. It's incredible what this stuff does. And it can be a big problem.
Yeah. And now when you have seen that there is layers, and between there's this kind of liquid stuff, I will come to that a little bit later, but this I want to show you also, because you can see that the vet is taking ultrasound image, and you see that all those gray and black and white stuff there, and you're like, oh, what is all this? Well, the whiter the stuff is, more it's like more fascia there is. So the connective tissue will be the whitest stuff. And when you look at here, I have been a little bit helping this one here. So the muscle layer will be, when you see it on the images, it's always red. And when you have the fascia itself, it's always white. And when you have superficial fascia, like the layer under the skin, you have also fat tissue there. Mm-hmm. And I think here comes also very intriguing area, because in humans they have already found that in this layer we have receptors which are reacting to the hormones, and they are embedded on this layer. So very, very interesting how the hormonal things are also connected to the fascia.
Wow.
And I think that's very wow. And of course you understand that one when you're pregnant, your body will change. You get more looser to get the baby out, the puppies out. The body is changing.
Yeah, so the hormonal influence on fascia as well.
Yes, as well.
Yeah. So this is an guys, just for those that are playing catch up. So this will be an ultrasound probe looking through tissue. So it'll be going through the skin, looking at the subcut fat, going down to the muscle underneath. And what Tuli's trying to show is these white lines that are running through it should not be overlooked. This is fascial layers. They're connecting, they're containing, they're sliding over each other. They're everywhere.
Yes, and there's hyaluronan between these layers and loose connective tissue. That's why it's blue in this image. And you can hear also, you can see this kind of fascia going into the muscle. So inside the muscle, we have also own fascial system. We have endomysium, perimysium, epimysium. So everything, it's not only the white stuff under the skin, it's also inside everywhere. And maybe this is helping with that idea.
Because this is the pork chop video.
Yeah, this is really, well, this is the horse leg. And you can see the hair here, and the skin will be this small part here. And this one will be the fascial layer, like the sock on top of the muscles. And then we have muscles, and we have the pockets for every muscle. So the muscles doesn't go where they don't want to go. So every muscle has an own pocket. And that pocket is attached to another muscle, or it can be attached to the bone, or more correct way to say periosteum, which is the fascia of the bone.
Yeah. And I think somebody that I've got a lot of respect for, Larry Davies, who's an amazing vet, she talks about the body just being, you know, thousands and thousands of pockets of fascia, and the muscles are slipped into them. Whereas everybody really promotes muscle, and that the fascia came secondary. But actually, you know, the fascia is in charge here. You know, they're dominating the fascia.
Yeah, and muscle is packed in that compartment which the fascia is creating. And now if you think again, if you have a dog long time immobilization after a surgery, for example, and there is no movement on these layers, it might get very stuck in this between those loose connective tissue layers. I will show you a couple of videos, I think, which will help you a lot to understand this one. Here it's zoomed also. This is a cross transcut, and you can see the hair and the loose connective. This is like the spider web. So between the thicker layers, you have this spider web-like tissue. And when I'm pulling that piece of fascia, you can see that the tension is going around on the other side even. And by this section is a little bit frosty in the middle, so that's why this one is not moving so much, but you can really see how this one is moving.
That's a brilliant video demonstrating how pulling just one area has a massive impact everywhere else. And there's a brilliant video on YouTube of a lady that's put a guy in a kind of a suit, leggings type suit. Elastin suit, and she pulls on the back of the suit, and you just see how his whole posture
will change.
Let's go, it comes back to normal, and then she'll pull somewhere else and the whole posture will change again. It's fascinating.
Yeah, and one thing I want to say on this video yet is here you have the nerves and the vessels. So check the other video. The nerves and the vessels are on the same corner here. And when I'm rotating the bone, see how much movement you can see everywhere. So moving the bones is the thing. And when you think, oh, well, how can I move the bones? You move, because then your bones move. So the movement is really the key element for the fascia to work properly.
Yeah. And as you said, you need to keep fascia moving. It's there to move.
Yeah, it's there to move. And if we talk about the hyaluronan, and the loose connective tissue is full of hyaluronan, and 3 days it's like the how do you say it in English? It's like it's getting the new hyaluronan. It's getting every 3rd day when you are moving. So you have to keep on. Yeah, it's like turnover time. Turnover time of the hyaluronan. It's 3 days.
Right.
So
and that's you more get like a nutritious kind of gel type thing that's layering on top of the fascia.
Yeah, because if you get immobilized for a long time, this layer, which you can see, it's this kind of clear, moist layer. I will show you the video because I think here you can really see how moist and how liquid it is. So if you are not moving, this one will glue together these dense layers.
Because now you have horse, isn't it? Did you say
this one is horse? Yeah.
Just in case someone thinks it's a human body, it's a horse.
Yeah, it's a horse. Yeah, and here you can see how much this is patella will be here, so it's stifled from the horse. So a lot of I will maybe play that one again because you can see how much movement there is also from side to side, not only up and down, and also if you are very good with the eyes, you can see that here is also vessels.
Yeah.
So vessels and nerves are also in this same area. So
Yeah.
blood supply, everything which is getting the nutrition, and also everything in the target tissue, they are going through these things.
I'm going to butt in again. I'm going to tell you something fascinating. I keep getting pins and needles in this arm. Just really nothing to worry about. But I know I've got poor posture, and I know I've got restricted upper back, and I know that it's not back related, it's not vertebral, it's not neurological, it's poor posture, it's poor movement, it's fascial adhesions. And I'm pretty sure that I've got a nerve, a little superficial nerve that's getting trapped and it's getting niggled, and I get this and I need to sort my back out.
Yeah, and if you think from the human, it's easy to ask that, do you feel pins and needles? Do you have numbness? But with the dogs, when they are licking some places more often, I'm very sure that in those places they have this kind of entrapment somewhere on the nervous system. So they need help if they are having this kind of like leaking too much in one joint, for example.
Yeah.
And for you, it would be like misuse of your back. So maybe you haven't been doing correct things, and maybe you have been doing too little things. Yeah, and maybe too much sitting in front of the computer. So misusing and disusing the body will cause that the connective tissue will respond on that one. And from here, I would highlight the role of water. So it's very important that the dog has always fresh water, because the hydration is the thing which keeps the loose connective tissue alive.
And you guys, remember to drink water. I've been bad.
Oh yeah.
Too much coffee, less water.
Yes, that's the thing. And then pH, and if we train too much, for example, it stiffens the fascia for a moment. And then we need again to get, like, it's the thing that you train and then you relax, and then you train and then you relax. So it's the balance between how much you do. So not getting to the point that you are overusing your body or the dog's body. And the temperature is very interesting thing, because well, if you put the steak in the fridge, it gets stiffer. So, and if you put it to the oven or to the warm place, it gets more flexible. So that's the thing in our body. So hyaluronan gets more liquid when there is more heat. So one thing again, be aware that there is warm in the body if there is problems in the myofascial system, or for example the arthritis. So then you need to keep the body warm, because the coldness will stick the layers, it will tense the body, and then the receptors, the nerves will react more and more and more. Yeah. Okay, immobilization, we already talked about that one, that it will glue also the loose connective tissue layers together, and that will cause some problems.
Let's just stay on this slide, and just because we're trying to keep it coming back to arthritis, the people that are on here very much about their arthritic dog, I want this to be relevant to you, but I know that there's going to be lots of students and therapists and vets listening as well. But for the arthritis aspect, keeping them warm, or making sure that they're warm and warmed up for exercise. So if you've got a dog that has got arthritic joints, has got an adapted posture, which has been there for a long time to limit pain, and they've therefore got fascial restrictions, fascial adhesions, unhealthy fascia that's not slipping and sliding and moving and happy, then letting them suddenly do explosive activity when that fascia isn't nice and warmed up is going to lead to damage. Keeping them warm is a really good idea. And as I say, think about this overuse and misuse. If you've got fascia that has become very adapted to a certain movement pattern, posture, suddenly breaking that posture, that movement pattern in a different direction, like slipping on a floor.
Like slipping on floor
Really
or in the stairs.
On the stairs. And it's not just going to be in the zone of the slip. In that, it's going to affect the whole body. So you can have a slip and it might be a forelimb going outwards and you go, oh, that's where the pathology, that's where the problem's going to be. But it can aggravate other parts of the body because of this fascial system. Is that fair to say?
Yes, that's very nicely done. Good. and I think always keep in mind that there is this liquid part in the body. And I strongly recommend that you learn to feel your dog's body, how it is when it's relaxed, how it is after training, how it feels when it's warm, and how it feels when it's stiff. Because collagen is always reacting. It's the tension and compression. The body is getting stronger with the tension and compression, but always it is also compensating. And some compensatory patterns, they might lead to that overloading of the fascial layers, and then we have joint problems, we have pain, we have behavioral issues. So many things are happening before you see it, because also the dog is hiding things. They are not showing things immediately that, oh, I feel awkward there. They might be hiding or getting a little bit, well, how to say, not so, yeah, not like, yeah. So they are maybe not so happy anymore with you coming into the room, or they are not showing their happiness so much anymore.
Yeah, so and I think, could you just go back? The compensating thing is really important to talk about, in that there is, to understand that our bodies are always compensating. We're always, like, just here now, I'm moving, I'm gesticulating with my hands. So much is going on in my body, and my body's compensating, changing, shifting, rebalance, rethink, reposture. But when you've got a compensation pattern that's there for a long time, so me at my laptop, leaning forward, hunched shoulders, neck forward, long periods of time of little movement, then that's when the fascia gets unhappy, isn't it?
Yes, and I think that's a very important part here also. You need movement. Everybody needs movement, that your range of motion in the joints, they are moved in every movement, like flexion, extension, abduction, adduction, rotation and rotation, and every combination you can imagine. So that is getting the fascia happy. When you are moving your body without pain, but you are moving it different angles, different speed, and different ways, not always the same thing, but changing something, but really like when you are getting the sponge and getting the water in the sponge and then you are squeezing it. It's the thing how you are getting the fascia really moist.
And then let's just stop again and remind people why this is important. Like, there's going to be people going, oh, well, fascia this, fascia that. But fascia leads to pain. If you've got unhappy fascia and restricted fascia that isn't allowed to do fluid movement, and it isn't allowed to expand and stretch and accommodate a certain movement, it can create pain. And that's what we're trying to limit. So Cam is always talking about your multimodal toolbox. And we've got our pharmaceuticals and we've got our interventions. We've got, supplements have their place. You've got your physiotherapy, your hydrotherapy, you've got your surgery, all of these things. And then Cam goes off a little bit and talks about keep your dog moving, do your your scenting games, your snuffle mats, your Kong feeding, get them up, moving little and often. And people quite often go, well, that's just the fairy dust. That's not that important, really. I want to put my dog on drugs because that's the pain relief. That's what's going to really make a big impact. Actually, the fairy dust, the keeping them moving, keeping them distracted, keeping them bending, flexing, extending, stretching, can have a massive impact on pain. And that's what CAM is about. CAM is about making sure that you use everything available to you, which is often free of charge.
Yes, very much. And if you look, here is like how the layers are moving. And when you have those bad compensational patterns, you might have this kind of points which are painful. And those are the dysfunctional point trigger points, or what you might call it in tensional points or pain trigger, whatever. But these are the points which are really tensing the suit or the wetsuit of the body or the chambers or whatever, but really pulling from the fascia and then causing abnormal firing on the muscles and the nervous system. And then you might have motor control problems where you have stumbling dog or sleeping dog, or it doesn't jump anymore so nicely to the couch, for example, or there is pain or limited range of motion.
Yeah.
Those are the things. And here is one example. We did this small study to show how the movement will change. This dog is here as really, we had, let me check how many dogs we had. I don't remember anymore. We have 12 dogs on this one. So we did 6 dogs with placebo treatment and fascial treatment with 6 dogs. And this is one of the fascial treatment dogs. So we did the hip extension, and we were doing the first restriction the dog was giving us, not pain, the restriction what was there. And then after the treatment, you can see how much more movement the dog could do. And the same goes with the abduction, maybe more with the extension even, but really you can change the range of motion quite rapidly, I would say.
Yeah, so, absolutely. So just so guys, you catch up. The yellow line is what Julia's actually drawn on, and she's showing from the point of the hip all the way down to the hock. So we've got an angle of hip extension. So this is how much the dog is happy to allow its leg to go behind him before he says, I don't like that anymore. Now, it might not be pain. It might be, this is what's comfortable to me before I just don't like it. It's not pleasant anymore. And then he's done manual therapy, which she's going to talk to you a bit about in a bit, and look at the dramatic improvement. And what we need good ranges of motion to function well. And that's one of the problems with arthritis.
Yes.
It's pain in the joint. It's the lack of movement.
And stiffness, because sometimes people think that, oh, it's getting stiff, but I think it's very like powerful dog. So you can see that the muscles are bulking, and when you feel it, you feel that it's like very stiff dog. But stiffness is not so good, because you should know how the tissue should feel. Well, stiff fascia has a small energy loss. So when you have very stiff things, you don't lose so much energy when you are moving. But in overall stiffness, which is affecting to the range of motion of the joint, it is needed more power when we want to move it in the normal motion, and then the speed and the strength will decrease, and of course the efficiency will drop at that point. And when we have stiffness, it causes abnormal muscle and neural activation, and then you end up to the situation that the risk of injury is very high. So if you are doing some sport with your dog, or if this dog has been doing some sports, for example, agility before, and then you notice, okay, there is arthritis of the hip, for example, it doesn't do any more agility, but you have to know what is in the history of the dog, what he or she has been doing, and what kind of movement patterns is there like behind of the system.
Yeah, I think this, again, I'm just going to keep tangenting back to the relevant topic, which is arthritis. And this will go out to owners of arthritic dogs and vets, because I can remember, well, it happens all the time. Owners come in and they say that their dog's arthritis has suddenly deteriorated. We immediately kind of say to ourselves, it must be like an acute flare-up and it must be related to the joint. But actually, has the dog done something that has disturbed unhappy fascia? So say this dog's got bilateral hip arthritis, And over months, if not years, it's had a restricted range of motion through those hips because they're quite painful to be used through their 160-degree range of motion. The range of motion's become less. So the fascia has not been stretched and extended and moved in and around, all around those areas. So that has begun over time to stiffen, to stick to each other. It doesn't slide over each other like it used to. It's become clunky. And then the dog sees a squirrel out of the blue, and he suddenly chases the squirrel. Those hips get extended beyond that happy zone. And not only may it aggravate the joint, but it potentially is aggravating fascia. And that pain response that we see, that deterioration, is fascial and soft tissue related rather than just being joint related.
Yes, so that's a very good example. Yeah.
Yeah, so like this is where we talk about, let's make sure we re-examine. Let's use our additional therapies such as heat therapy, rest, but keep them moving. Techniques, then you've got your lasers and your ultrasounds and all of these things come in behind.
Yeah, that's so true. For the last bits, I would like to tell you about the fascial recoil, because that's very catapult effect we have in our body. It's in the dog's body. It's many animals are using this same phenomenon when they are moving, and it's again gliding between the layers, the loose connective tissue providing that movement, and then loading the force. Well, maybe kangaroo will be a good example because everybody knows how the kangaroos are jumping. But and of course the dogs, when they are jumping, they are using the same. They are tensing the tissues and then they are jumping and releasing the tension. And Slow Motion Guys has been doing this excellent video about a cat, and you can see it first when the cat is jumping from the tree like this, and then you see the same jumping coming in slow motion. And here you really understand how the body is absorbing the energy and how the tension it's coming, like the ground reaction force is coming to the body, and how the body is getting that in and then just absorbing it and then moving forward. So there's cats are maybe the best ones in this. So
incredible.
I would say so. So slow motion images are really revealing how the body is working. And then another good example is a flea. So the flea is flexing the legs and tensing and then releasing and jumping like here. So, and if we would think that we would be fleas or the fleas would be humans, they could be jumping over the Eiffel Tower. So that is the amount of tension they are loading. They are not really like bodybuilders. You don't see big muscles, because big muscles doesn't mean that you can do things like higher or faster or things like that, because it's the cooperation with the fascia and with the muscles and working joints, because joint is allowing the movement you need. So it's like, I would say in the end that you really need healthy joints to get control, strength, the mobility the body needs, and the optimal myofascial system. And elasticity of the fascia varies between different breeds. So it's also important to know what kind of fascia is in your dog. Because if you have, for example, Border Collie or Poodle, they are more flexible. They have more sensitive nervous system. They have the loose connective tissue is different than, for example, Mastiffs or Boxers or things like that. So it's very different between the breeds.
That's amazing, isn't it? That's amazing.
Yeah. I would say so. And when we want to have motivated and happy dog, and of course, when we have motivated and happy dog, we have a happy owner, I would
Yes.
say.
Yeah.
So I think the movement, it's really the thing. When you keep your dog in movement and you learn to feel how it should feel when it's relaxed and good, then you are in a good path.
Okay, so let's bring this now back to our arthritis, because
Yes.
when CAM started, I definitely say that people that were on the platform had dogs with arthritis. But now that we've been going for nearly 5-6 years, we've got owners that are still with us that have young dogs that don't have arthritis, but they're so aware of the prevalence. And for people that don't know the prevalence, 80% of dogs over the age of 8, but it is more likely that 35 to 40% of all ages have arthritis, even as young as 4 or 6 months old. So we have a lot of followers that have stayed with us with their younger dogs that are coming in, taking on the mantle. So let's try and bring this back. Let's talk about owners that have got arthritic dogs. They've listened in, they've gone, great, this is really fascinating. I'm blown away with the science. What does it mean to me? What can I be doing? Is it going to make my dog's life better? What can we say for them?
We would say that movement is really the key.
Mm-hmm.
And this kind of you could say safety movement, that it's moving throughout the body and getting flexibility back to the body when it's moving. And then the hydration, so fresh water to give the body what it needs. So movement will be the first step, and like variable movement, and then get the things on order.
We were being a little bit kind of blunt offline, weren't we, saying that it's very easy to pop pills and take the medications. It's a quick moment in time that everybody can kind of manage in their day. But time and spending time doing targeted exercise, variable movement patterns, as the lovely Laura Eldridge, who I know is listening, she blew me away a few weeks ago by talking about stealth therapy. And I've just stolen it. I'm using it all the time, which is getting wanted movements out of your dog, but getting them to do normal activities that they enjoy doing. So you look at the activity and go, they're enjoying it, but they're also stretching down their top line, they're bending, they're flexing, they're balancing, they're shifting. Yes, I've got twice for the money. Yeah.
And I would say also, when you are rewarding the dog and doing things in cooperation, the dog is happy. When you get connected with him or her, I think it's always like the dog wants to be with you.
Yeah.
It doesn't want to be there forgotten on the bed that, it's also old and it doesn't want to go out and it wants to sleep there.
Yeah, you also get that emotional connection.
Yeah.
Stealth therapy, you've got your distraction, but you've also got that mental, emotional happiness, which we also know is another very powerful pain control. Think about it. I've got a backache at the moment, that if someone comes in and goes, hey, I haven't seen you for ages, I'm like, I've completely forgotten my backache because I'm so happy to see you. So we have to remember how powerful the brain is. So I wanted to get Tulia on to talk about the fact that keeping your dog moving, investing in seeing a physio, listening, even if you see them once and you get an exercise plan that's going to keep your dog flexible to the best of your ability, is a really, really good investment. Because remember to what I just said, if you've got a dog that has got pain in their joints, they've therefore got restricted joint range of motion because it's sore, they've therefore got adapted fascia because it hasn't been moved as it used to be moved, so that's clamped down, it's kind of got thicker, tighter, it's got less movement. So when they do something, either wanted or unwanted, explosive, chasing a squirrel or slipping on a slippery floor, that fascia is unforgiving, and that fascia can create pain. And then you've got a joint with pain, you've got fascia with pain. So keeping your dog moving is a very big tool in your toolbox to minimize discomfort. It's a good investment. keeping them warm. That's why we talk about coats. We talk about keeping them from drafty areas, try and encourage them not to sleep on cold floors if that's what they want. Always give them choice. Again, you're keeping the soft tissue happy, moving, fluid. So these things that you kind of go, oh, they're not important.
I think that's very good. Yeah, and I think one more thing I want to say in the end, that the repairing the fascia, it's the slowest process. Bone will heal pretty quickly if you compare it to the fascial problems, yeah, because it takes 360 days to be like it was. So
yeah, because like you look at the nervous system, I think the nervous system can regrow nerves at like something like 1 millimeter a day or something like
yeah,
that.
it is like that. Yeah, and like if you have muscle problems or that one, you get pretty okay in 2 months, but people tend to forget that you need rehabilitation and you need progressive training if you want to be back on the same place you were, because
Definitely.
quite often you are doing too much also and do heavy things and you forget that, oh, for that fascia, forgotten fascia.
Yeah. But it also makes you look back through, and I'm going to go a bit off tangent, but you look back through different cultures like Tai Chi and yoga, and these things is very much about keeping range of motion, fluid movement, keeps the body healthy, keeps the body balanced, prevents further injuries. And that is really, CAM was created to try and make sure you guys have made the most of all of those free of charge, sensible, no side effect interventions. And this fits massively into that set. So we've got a couple of questions. Okay, does fascia in the older dog get less flexible or become more thin?
It gets less flexible. That has been seen in the studies. But in fact, when the dog has pain, the fascia gets thicker. It has studied in humans, for example, in the neck area. If the human has neck pain, the fascia of the neck is getting thicker. So in fact, it is not good to have very thick fascia. It's good to have elastic fascia. So in that way, it's a little bit crazy to think, because always you think, when you think muscles, it's the more bigger muscles, the better you are. But in fascia, it's really like elastiness. So elasticity is the thing.
I think, I don't know if you ever got to watch one of the presentations, but Karen Perry Butler was talking about hip surgery, and she was describing that one dog who had a very dysplastic hip, so it wasn't a nice ball and socket, it was pretty much like this.
Yeah.
When she went to do the total hip replacement and to cut through the joint capsule to access the joint, it was an inch thick. So this is normally a joint capsule that should be no more than like 1 to 2 millimeters thick. You know, really thin, elastic, mobile pocket of joint fluid was an inch thick.
Yes.
That's crazy.
Yes, and that fits. When doing dissections, I see the same every time. When I know that the animal has been in pain, there is increased thickness.
Increases. Okay, next question. This is a tricky one, and there isn't black and white answers to this. I think I was talking to the lovely Kathy Murphy, going to stitch up now and say that she's going to come and do a talk on dementia soon, because I can't pin her down. But now that I've said it live, and everybody needs to say, yes, we want Dr. Kathy Murphy to come back and talk about dementia. We were talking the other day how there's a real tendency to go binary. It's either this or that, and that isn't life. I think the trend for confining dogs and puppy in crates, I think a lot of people are realizing that it's not a good thing. But then when you've got the variables that the dog might have just had a fractured bone surgery, it's got a plate, and you've got a period of time where you really do need to restrict that dog's movements, and you can't control that dog jumping up at the windowsill, chasing the postman, following the cat. There's always a balance. So it's juggling the variables. What would you say to that?
I would say that really the same, that it's very individual. And then it's very balanced between that you have to secure the situation. And then you have to think, okay, what can I do with this individual? How much can I do? What can I do? And when?
I do think, though, I think it would be fascinating if information like this was given to owners of young dogs. So everyone's got this really big belief that within puppy socialization, first vaccines, in that time, we shouldn't just be giving owners information about worming protocols and vaccination protocols and all this. We should also teach them how to identify pain, so that when it does come, because I'm afraid at some point you will see pain in your pet, it's not avoidable. When it does come, they're aware of how it's going to express and they can therefore act on it. I also feel that we should equip them to understand bodies and the body movement and what it's capable of and how it should be respected. And wouldn't it be amazing if in 5 to 10 years' time, you found every vet's assessment is a full physical of the muscular fascial skeletal system as well. So we're very good at listening to hearts and checking teeth, looking at eyes, ears, feeling the abdomen. But I know that it's only recently I've started collecting the skills to feel the rest of the body as well. And now that we know that arthritis is the leading cause of elective euthanasia, it's the biggest reason that we say goodbye to our dogs, often prematurely. Would that change the way that we think about their musculoskeletal system and keeping an eye on it more and picking up these early injuries and early restrictions and adhesions? How different it would be.
Yeah, and then also understanding that is this individual very hypermobile, for example? Because when you have very hypermobile, you tend to have problems with the fascia more than with the stiff.
Yeah.
But with the stiff one, you might have the problems with the joint motion and these kind of things. But when you take care of those ones, it's fine. But the hypermobile ones, because they are quite often overactive.
Yeah.
So you tend to get injuries with those ones.
So I'll tell you who's doing stuff about that. That's David Levine over at University of Tennessee. Ehlers-Danlos syndrome?
Yes. That would be the extreme hypermobility then.
Yeah. Have you seen it in dogs?
Well, I have more human patients with EDS, but I would say maybe a couple of horses and maybe only a couple of dogs. But I have very hypermobile dogs as a customers. So they tend to have problems. And quite often they are agility dogs, of course, because they are high speed and they can do very quick pole things or going to the friends. But quite often they tend to have also issues with the wrist or with the hips or with the elbows.
Yeah, fascinating. So guys, hopefully this Facebook Live makes a bit more sense now. I've been wanting to do this for such a long time. I did a lecture a couple of years ago to a group of vets talking about the importance of preventing further injuries and how modifying the environment and making sure they don't do further harm, more drugs, less drugs, and trying to actually really substantiate these beliefs. This intervention was really, really hard. And it wasn't after the event, I thought, oh, God, why didn't I talk about fascia? Because it would have been very scientifically sound advice, the reasoning behind preventing further injuries. Next time. So thank you so much for listening, guys. We've had an amazing turnout tonight. So that tells us that Julia's just got to come back, really. I would love her to come back and talk more about the fascial lines. I think that will really take you on to a completely different level. Because Rebecca and have been dissecting for about 10 years now, haven't you? And been actually looking at sort of tension lines. Would that be right? Tension lines?
Yes, tension line is a good way of thinking, yes.
Yeah, that was the best weekend ever, just looking at a dog in a completely different way. So I'm going to persuade you to come back.
That's fine.
Cool. Well, thank you very much for listening, guys. And we will be back next week. I think we've got a lovely guy called Jax joining us who runs a pain clinic. So he is going to be talking to us about all the things that happen in one of these referral centres. So you can see what the point of pain clinics are. So until then, I'd like to say thank you, Tulia.
Thank you.
Until next week. See you later.
See you.